Hello, lovely. I'm Dr. Nicola. It's nice to meet you. How are you? Good. I'm good, thank you. So, my love, I've not seen you before. How can I help you? Okay. Right. Whereabouts? Okay. I can have a look properly, don't worry. Yeah? Sure. Yeah, I can do that. Not to worry. Okay? Alright now, you just relax, okay? And yeah, you're looking a bit anxious. Oh, lovely. You worried? Yeah. It's probably nothing to worry about. Alright, so I've got my notes. If I can get you to just confirm your full name. Thank you. And your date of birth. Thank you. So, have you been to a dermatologist before? Okay. That's fine. So, you found a patch on your arm, okay, which you think is like a mole. Alright, so it's never been there before, okay? Okay, so new. I will have a look in a moment, so don't worry. And when did you notice that? Okay. Right. So you noticed it, but you didn't think much of it, but then it's got bigger. Okay. And when did you notice it start to get a lot more noticeable? Okay, that's fine. And you went to your doctor, and what did they suggest? They come to me, yeah. And did they think it looked okay? Yeah, so just to make sure. Okay, that's fine. And the other issue is concerned about your skin. I'm guessing that's with the breakouts. Yeah. So you're worried about whether you've got acne and problems with your pores. Okay. So when you say your pores, do you mean like blackheads and things like that, or? Right. Okay. So we've got two issues to look at. All right. Now, going back to the patch, have you noticed any other patches on you at all? Okay, so on your face, so more like lots of little freckles. Okay. And anywhere else? Okay, so maybe a little bit on your arms. Were you out in the sun a lot this year? Okay, did you wear any sun lotion? Okay. And did we go away abroad? Where did you go? Oh, lovely. That sounds nice. Did you have a nice time? Good. So you have been wearing sun lotion, which is good. What factor? Okay. That's fine. And have you burnt badly before? Okay. That's fine. Do you use sunbeds at all? Okay. Alright. So have you got any other moles on your body? Okay. No moles. What about birthmarks? Okay. That's fine. So no birthmarks, no moles, which is fine. We've got a patch there and some freckles on your face and your arms. Okay. And you've noticed that since the summer, really? Okay. It's quite common to get freckles when we're out in the sun a lot. Yeah, that's right, it's quite common, especially after summer. Yeah, and then you'll find some of the patches may go a bit bigger, which is probably what you're seeing on your arm. Alright, yeah. And as we get older, we can get like age spots and things as well, which are very the same. So it's all to do with pigmentation. Alright, yeah, but I will have a look and assess properly. Okay, I'll have to have a look with my special light and magnifier, have a feel around, and then take some measurements. Okay, yeah, and then I'll obviously check out the other pigmentation in your arms and your face, and I will have a look at your face. Alright, and especially concentrating on the cheek areas. Okay, right, so I'm just going to ask you about your face now. Do you use any products at all? Okay, what do you use? Yeah. Okay. Yeah, okay. Okay. Right, so when have you noticed your skin change? Okay. Alright, so okay, so about a year ago you started to get breakouts. Okay, and where did they start? Yeah, okay. And what did they look like? So your typical whiteheads, yeah. You notice more blackheads than usual. Okay. And then did you find that they were staying for a while? Did they go? Okay. Yeah. And then they gradually just started getting more, and then they kind of didn't disappear. Okay. Would you say this is the worst you've been? Okay. Okay. Yeah. A year ago, did anything stressful happen in your life? Anything at all, or something significant, or even something minor? Okay. Okay. Right. And are you on any medication? Yeah. And what's that for? Okay. Anything else? Okay. That's fine. And how long have you been on those for? Okay, so a lot longer than before this started. Okay, so it's probably nothing to do with the medication then. Do you have any allergies? Okay. Right, that's fine. So the products that you're using, it's good that you're using something, but they're probably not the best products to use. Alright, yeah. It's very important that we look after our skin, but that we're using good products, okay? Yeah. Now some of these products that you mentioned actually are going to be doing more harm than good. They're going to be stripping your skin and your natural barrier, and you're going to be causing more damage. Yeah, and a lot of the time you think, oh, again, spots getting acne, we need to get on all this strong, potent kind of random stuff, and it's not the right way to go. We need to try and have a good routine using good products to help. Alright, yeah. Now, do you touch your face a lot? Stop doing that, okay? You're popping bacteria back on your face. I know this is something done, but that's what you're doing. Alright. And we need to have a good cleanse, a tone, and a moisturiser, and exfoliating at least once a week, and a face mask at least once a week. Okay, this should be across the board, but I want you to be doing that. It's good to have like an eye cream and serums and oils and things like that as well, but at the moment I want to concentrate on getting a good routine. Yeah, okay. Now, have you had any treatment for the spots at the doctor's? Okay, so you've been given, yeah, so you've had the topical treatment and antibiotics orally. Okay, and they give you an alcohol wash. Yeah, okay. And did they recommend any particular treatments or anything like that? Okay. So none of that's worked. And have you tried just soap and water? Okay. That's fine. So, just by looking at you, it does appear that you do have acne. Alright. It's quite cystic, so like boils. Yeah. Do you find that you've been getting breakouts, but they don't necessarily go into a white head? They just stay this big red lump, and they just take forever to go. Yeah. Okay. Some of them do look like that. Yeah. Okay. And they hurt. Yeah. Do you get any itching? And do you pick? You can't help it. So, briefly looking, I can see that you've got some whiteheads. You've got a lot more boils. And around your skin, your pores are very open. A lot of dirt in there, which is your blackhead, so we can see exactly what you mean. Yeah. Okay. So you've got your open pores. Now, a lot of that can happen, especially if you have picked or have a new scar and you get pitting, and then that can get dirt stuck in it and that as well. Yeah. So have you noticed any scarring? Okay. Don't worry, you can work on all that. Don't worry about any of that at this stage. Alright. Now, do you drink any water? Okay, so that's really good. And what kind of things do you like to eat? And I'm not here to assess your diet, don't worry, but I just want to get an idea of what it is you're having. Yeah. Okay. Would you say you got quite a healthy, balanced diet, or do you think it can be better? Okay. Yeah. So some of the things that you've listed could potentially be hindering the acne, making it worse, like cheese, chocolate and things like that, okay? But it doesn't mean that's what's causing it. Okay. Have you had your hormones tested at all? Right, and what was that? Okay, no. We need to do other ones than that, okay? Yeah. So, I will do bloods then today. When did you last have a health check? And how was everything? That's really good. Perfect. Alright then, so don't have to worry about any of that. I will take some bloods and I'll do some swabs of your face as well. I'll have a good look and examine it, feel it around and do different things like that, okay? Yeah. Okay then. Is there anything else you'd like to tell me that you haven't told me or ask me? Yeah? Okay. If you do think of anything, please let me know. Right, so perfect. Have you got anything on your face? Okay, great. on my gloves. Right, if I can have a look at your arm first. Thank you. Yeah, so these little things here are literally from the sunspots, okay. They all look normal, they're all pretty small in size. A couple of little big ones like that one's a little bit bigger. No raising or anything like that. Right, now let me have a look at this patch. So it's not raised, which is fine. Can I just look at your other arm? Thank you. Yeah, so these are exactly the same as the other side. All feel perfectly normal. Okay, so let me go back to this one. Okay. Keep your arm there for me, thank you. Right, keep nice and still. Okay, measurement that way. Right. Now I'm going to pop these silly glasses on, okay? So I'm going to look ridiculous, but needs must or not. Right. Okay, can I have your arm? Thank you. I need a different one. That should be fine. I know, I told you I look ridiculous. Okay. 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 Ah, much better. Yeah. That's good. Yeah. Looks fine. Perfect. Coach. Yeah, very good. Sorry. That way. Can I just look at the other side? Thank you. Yes, everyone laughs at me actually. Okay. Let's just get something. There we go. There's a little bit of an ingrown hair though. Yeah. Okay, just double check this side. Yeah. Sorry, I do talk to myself a lot when I do this. So I do apologise. Yeah. A slight bit raised there. Yeah. Okay. Let's take these silly things off. So that's nothing to worry about. Okay, so obviously different things to kind of look at. Okay, now what you've got isn't actually a mole. Okay, so it is a bit of pigmentation. This looks perfectly normal, perfectly healthy at the moment. Okay, so just monitor it If you notice it gets really big, really different edges and different things like that, obviously you can see I've marked it. So I'm going to take a picture, alright? So I've got that on file. So then I can see if it does get bigger and how long it gets bigger. Okay, so for example, if I mark that now and then say in a week's time it's like over it, then we'd have to come and do something about it. But looking at that, I don't need to take any samples of it, I don't need to biopsy it, I don't need to do anything, it just looks like normal pigmentation. Alright, it's just a little bit bigger than everywhere else. Well, I know it's quite bigger than some, but you know what I mean. Yeah, so it's nothing to worry about. Yeah, I'm not concerned. If I was, I would do something, okay? There's no swelling there or anything like that, no hair or anything like that. No bleeding, no discharge, nothing's perfectly fine. Yeah, so it's literally just from the sun, and it just happens to be a bigger patch, that's all. But like I said, please do monitor it anyway. Just, you know, once a month, just have a check. Okay, so it's nothing to worry about, okay? It's just normal pigmentation. That's obviously bigger than other areas. So it's just to the sun. Please monitor it, you know, for any changes and things like that, as I said. But, you know, if you notice any bleeding, any discharge, any scabbing or anything like that, if you notice any other patches appear or, you know, anything abnormal, please don't hesitate but to get in touch, okay? But all that on your arms is just general pigmentation from the sun. You may find it will fade through the autumn, winter, and then spring, summer, it will probably come out again. Yeah, that patch there, you might find that will always stay. It probably won't go. The smaller ones may, but that one will probably stay, okay? It is a lot larger, but as you can see where it's outlined, you know, so if it goes beyond that or if it starts changing shape and different things like that, so we do need to monitor it once a month. But as it stands at the moment, I'm happy with it, okay? There's nothing to worry about. Yeah, it looks fine, feels fine, okay? Yeah. Right. Happy? Good. So, am I alright if I touch your face? Yeah, so I can examine and come close. Perfect. Thank you. So, let's have a look. Okay. Just feeling your face at the moment. Just feeling how rough or smooth and if it's bumpy or not. Just trying to feel the texture. Okay. Okay, you can relax. Have you noticed any spots or anything anywhere else on your body? So nothing on your back? Okay. So your nose, some black hairs, but you know, fairly normal amount really. Quite the same on the chin. Now your skin isn't oily. Can get an oily T-zone in the afternoon. It's usually because our skin's dehydrated more than oily. If you had oily skin, it'd be kind of be all the time, and if you've got oily skin, it's usually pretty noticeable. Alright, and that obviously can cause spots because obviously the extra sebum, but a lot of the time in acne you don't necessarily see oily skin. It can feel a bit oily around the spotty area, but as a whole, you know, the skin is usually quite dry, which yours is looking very tight, very dry and very uncomfortable, and he's really, really angry. And I think a lot of that has been to do with what you've been using on your skin as well. Yeah. Just checking the hairline. Looks good so far. Good. Let me check your brows. Yeah, feels good. That's perfect. Good. Yeah, your forehead is extremely dry. Dehydrated. If I go like that, you can see the dehydration lines. Yeah. That's the problem, you see. A lot of the time people keep plastering all this stuff on for oily skin and for acne, and it's just too stringent, too potent and things like that, and you know, it ends up just damaging the whole of the skin, you know. I mean, there's special things that obviously we could be using, but you know, a lot of the time even these cheaper brands, they haven't even got a good amount of stuff in them that you need. Okay, so that's fine and quite clear. Just going to go around your ear. Okay, can't feel anything. That's all fine too. So it just seems to be your cheeks, which is good. So now I'm just going to examine the cheeks, okay, in a bit more detail. Is that sore? Yeah. It's very dehydrated there too, but definitely feel the oil around. Yes, it's very similar, you know. Is that sore as well? Yeah. Okay. Close your eyes. Okay, can open. Yes, it's just here. And now, because I've been touching, it's quite red. It's very inflamed. Just bring this light in. Okay. Okay. Yeah. It's very red, very angry. Yeah. Okay. Yeah. Okay. That's good. Yeah. That's alright. Okay. I'm just going to squeeze. Is it painful? Squeeze. And just squeeze. Squeeze. Yeah, there's definitely nothing coming up to the surface. It's just like solid boils, really. Some whiteheads there. I'm going to take some swabs of that before I do anything else, okay? Yeah. Okay. Need that one. This and that tube. Okay. Right. Now I want this one. Okay. Perfect. Okay. Just trying to get some loose skin off. Because you've got flaking around some of the boils. Just trying to peel that off. That's it. Okay. a wipe. Just let that dry. Right. And that's just normal pigmentation as well from the sun. Alright. just want to have a look at this light. Perfect. Right, I'm going to squeeze one of these white heads. Okay. Alright, just deep breaths with me, okay? Yeah, we do well. Okay. That's it. Now let's just come out. Yeah, no bleeding, just the white pus. Yeah. Okay. Now I'm going to do the other side. I'm going to do this one here. Okay, do well, just breathe. That's it. Perfect. Okay, so I can take those for sampling as well. There's quite a hole there underneath already. Yeah. I mean, I can see some scarring underneath. It's expected, especially if you itch or pick. Okay, my love. Feeling alright? Good. Okay. Okay. So obviously when looking through with the light I can see the bacteria build up. Okay. So I'm going to try and get rid of that. Got a lot of dead skin coming off, which shows to me you haven't had a really good exfoliation, a proper one. I'm going to put my silly thing back on, okay? And I'm going to laugh because my eyes are going to look big. Trust me, they're not as big as some, because these ones are not very magnifying. So, you ready? Okay. Don't laugh. I told you not to laugh. Okay. Big eyes, haven't I? Yeah, that's good. Okay. Don't worry, I won't be popping that on again. Right. I always make people laugh with that. Okay. Right. Just going to last a couple of checks. Wonderful. Okay, so you've definitely got acne, cystic type of acne. Right, so I want you to come back to me, okay? I want to carry out a proper medicated facial, alright? So, it will consist of double cleanse. The first one is going to remove any oils or any impurities, okay, any grime and different bits like that. The second one is going to really cleanse your skin deeply. Alright. Then I'm going to exfoliate with a salicylic acid, high strength, okay. Won't need to do a steam. I'll probably get some of the blackheads out, okay, if they will come out. So extraction just on these areas where I can see them. If after I've removed the dead skin they become loose. I don't want to steam your face at this stage, okay. I don't want to be picking too much. So extraction of blackheads if possible, okay, and just there, I'm not looking at anywhere else at the moment, I'm just concentrating here, okay, then I'm going to pop on a special mask. Now the mask will only be on the cheek areas, okay, and this has got all sorts of different acids in it, okay, vitamins, your retinol, it's got hyaluronic acid, salicylic acid, niacinamide, okay, soric acid. It's got quite a few different ingredients in there, okay. So the cleanser is obviously going to be all over your face. The exfoliator is going to be over all your face because I feel like the whole of your skin needs good exfoliation. Now, the mask that I've mentioned will just be on your cheeks, but everywhere else I will be popping another one on, which has got hyaluronic acid in it. It's brightening to help with any pigmentation. It's also got vitamin C in there, and that's going to help hydrate as well. I feel like we need some hydration, okay. Good. Then I'm going to be applying special treatments to your acne only, okay. I've got different serums that I need to apply and massage in. Then a moisturiser which will go all over. Okay. Again, all these are medicated products and you can only get within here or in the clinic. We don't give these high strengths out to patients though, they are only in clinic, but we can give the same range but at a better level. It can only be prescribed by myself or one of the other dermatologists here at the clinic, okay? And you can't get these online or anything like that because they're still a high strength, but not as high strength as what I'm going to be using, if that makes sense. Okay, so that's what we need to do, and that will give me a good base and your face will be as a good starting point. Okay, then I'm going to give you a treatment. So we're going to give you your cleanse, tone, moisturizer, and then a special product which has niacinamide, soric acid, retinol, hyaluronic acid, and that's going to be a serum, but you can only apply that to the acne. Okay, don't apply it anywhere else. Alright. I will give you an exfoliator as well. That's just going to be a general exfoliator. Alright, it's going to be very light, not too abrasive, because we don't want anything too abrasive so it's scratching your skin off and your barriers, okay? So it's just going to be a light one that you can use twice a week. And I'll also be giving you a special hydrating mask for all of your face, okay? They are sheet masks and they're special hydrating ones, okay? Going to give you some moisture back and some water back into your skin. Alright, I think it's really necessary. It also has a calming effect, so it will calm and soothe all of your skin. Yeah. No, I won't be popping anything else strong on your cheeks. That will only be something that I will do here. Alright, with a mask, okay. And same with the exfoliation. I just want you to just exfoliate, remove your dead skin as you should be anyway. Alright. Okay, and these are going to be formulated for you specifically. Alright, so I'm going to take away and look at all the swabs, get all that checked out and do all that, get the results back in and work out all the proper measurements that you need for your skin from what I've examined today and different things like that, okay? Yeah, and that will be ready for you for when I see you, when we have the facial. Alright, so that's the starting point. I also want to give you a course of antibiotics. No, not Roaccutane, I want to use something else. I don't want to go in, that's really quite harsh, and with me using these medicated products as well, I don't really want to be using that. They are not going to be stronger than the ones that you had from your doctor. And they're especially for this type of acne, okay? So that's going to be a rolling course, alright? So that's month by month, we're going to assess it. Sometimes people are on those treatments far too long. Yeah, so I'm just going to monitor you, and especially because you're using this special medicated skincare, it is insane. It is amazing, the ingredients in it, and as it's designed specifically for your skin, it's going to be working the job, and they are brilliant and the ingredients that we need to treat your acne. Alright, so the antibiotics you definitely need a minimum of 2 months. That has to be, and then after then it will either be we don't need any more, or we'll do 1 month, see how we get on, 2 months, etc. Does that make sense? Good. I will have to be seeing you regular. I will need to see you monthly for the medicated facials, and obviously I adjust the amounts of product each time in your facial, and once the treatment of yours has run out the first time, then I have to adjust the amount of product in your home ones as well. Okay, so it's like a constant thing like that. Good. Okay, that's fine. Yeah, don't worry, later down the line if we need to, I can do more extractions even on the rest of your skin. Then obviously when we've sorted out the problem, we can start getting moisture back into your skin, hydration, you know, making your skin feel nice and supple and may heal it, okay? And then we can do some laser if need to, or some microdermabrasion or something like that. But you'll find after time it will settle anyway, and you can't necessarily see a great deal of it. Yeah, I mean, it is, your acne is just here and here. It is quite angry red and quite cystic and big, you know, and quite a lot of them, but I have seen a lot worse. Okay, and we managed to sort them out, and they're very happy, and they don't really have a great deal of noticeable scarring, so, you know, we've got a lot of hope, don't worry. Okay, my love. Yeah. Okay, so that's good. So, and advice to you would be refrain from touching your face as much as possible. Okay, and you'll find that when you touch it, it might feel greasy. Okay, if you do that, wash your hands. Okay, and then if you feel like you need to touch your face for a purpose, wash your hands first. Okay, you need to keep clean and hygienic. Now, if you are wearing makeup, please wash it off properly before bed. Okay, yes, it has to be completely off. All right. Obviously, you need to make sure you're using your skincare. Okay, so that's fine. We can sort that out. Try to drink as much water as possible. Obviously, I don't want you changing your diet or anything like that. I'm not a diet specialist, but if you could try to limit the amount of cheese or chocolate or things like that, and late at night, reduce the sugar intake a little bit. All right, and just monitor that for a little while. Okay. Stop using the products that you have got. All right, so between now and then, I just want you using warm water. Okay, and then obviously a splash of cold water afterwards, just to close any pores up. All right, you'll find it might feel a bit weird and your skin might feel very dry, but we do want to dry it out because we don't want so much sebum coming through, but we don't want to damage the skin. Okay, that's just going to help me prepare your skin for your facial. All right. Okay. Okay, we'll take bloods in a moment. I've got all sorts of different bloods I want to check. Okay, and it will give me a good indicator if there's anything like that that's causing the problem, because then if so, we can work on that problem as well, and that's going to help. All right. So if you do wear makeup, so I'll make sure you are cleaning your brushes in between use. All right, and really clean them properly. Get some cleaner or something like that. Yeah. Okay. Okay, that's fine. Now, if you could try to use a silk pillowcase, okay? Yeah, they're a lot better for you. So you're not rubbing, it's not rough, you know, you're not causing damage to the skin. And obviously silk, it doesn't have the same build-up of product and sweat and things like that as a normal cotton pillowcase. So if you can use one of those, okay, plus they're nice and soft and they're actually quite good for your hair. So yeah, so silk pillowcase is a must, okay? Yeah, anyone look at Amazon or something like that. Okay. Okay, that's fine. So, do you have any questions for me? I know I've gave you so much information. Okay. Okay, that's fine then. Right, let me do your blood. Now, what you like with blood? Okay, don't look. What are your veins like? Are they all right or are they funny? Better than mine then. Mine's a right nightmare. Which arm do they normally take from? Okay, just do some pumping with both. Okay, look. Okay, keep pumping for me. Pump, that's it. Okay, that's that one. And we want that. Okay. Okay, let me have a feel? Yeah, this one. Okay, you can relax the other arm, but keep a fist in that one. Okay. Right, okay, now slowly release the fist. Okay, sharp scratch. Good, well done, nice breaths. Nice breaths. Just this one more, then we're done. Press that nice down for me. Yep, thank you very much. Let me have a look. Let's push down a little bit harder for you. Okay, I'll get all these sent off, get them all done, and then if you can see you in a week or two. Alright. That's fine. There we go. So, my love, do you have any questions? Alright. Oh, you were very welcome, my lovely. Okay, we will get you sorted, I promise you. So when you go out to reception, if you can speak to Angela and get her to book you an appointment with, you know, about 1 to 2 weeks. Alright, and say you want the facial, and she'll know exactly what I mean. Yeah, and then I'll pop all the notes and everything on the system when you've gone, so I will know everything and where I'm at and what I'll be doing, okay? Yeah, so I just need to take a couple of photos, and then we can head off out. Right, if I can have a look at your arm, thank you. Okay, very much. Okay, perfect. All the pictures done. Right, my love. It was nice to meet you. I'm sorry in these circumstances, but like I say, we will get you sorted. You're very welcome, my lovely. You take care now. Bye-bye.